there's a lot of suspicion, there's a lot of accusation, and there's a lot of hopelessness that is permeating these discussions amongst my healthcare colleagues. Hello and welcome to the Restore Healthcare Project podcast. I'm your host, Dr. Jennifer Kang. Happy to have you here with me. And just to remind you, we'd love for you to follow, like, subscribe, and give us a 5-star review. Help us continue to reach more of our healthcare heroes. I've been feeling lately some angst. And I want to speak to that a little bit today because I do have such a heart for my fellow healthcare colleagues. And the angst that I've been feeling is going to seem really a bit familiar to many of you. And you're probably experiencing some of it right now. And that is, we are undergoing change in our political and cultural climate. And some of it does seem to have the potential to affect our healthcare sphere. And some of us are processing that in a way that's causing a lot of anxiety and angst. I know that there's been a recent transition in the U.S. in our presidential administration, and that transition comes with a lot of political upheaval sometimes, and sometimes it's positive, and sometimes it's negative, and sometimes we're not sure which we're going to really see played out for us. And recently, we've been assaulted, I feel, by a lot of media buzz around the forming of a new administration in our country. And we get to see these honestly quite horrific Senate confirmation hearings. I say horrific because that's how I feel when I'm watching them. It's always been that way. It's nothing new. But when I watch these back and forth, these terrible assertions about people's character and beliefs, whether or not that's what they're actually saying, and just the accusation from one political party to the other, all the maneuvering and gamesmanship, it's tiresome, isn't it? I find the back and forth upsetting, and I don't know if you relate to this as well. And some of it is upsetting because perhaps there's something in you that does align with a particular political viewpoint, and it's upsetting because you don't agree with it. And some of it's upsetting because there's something inherently in it that is so accusatory and so derogatory that it's upsetting. And I know that in particular, my healthcare colleagues currently are interested in who is going to be nominated and confirmed for Health and Human Services Secretary. And there's a lot of controversy. And the nominee that's been going through Senate hearings currently, as I film this, is perhaps very controversial to many professional healthcare providers. And I actually was very interested in watching one of our U.S. senators who's also a physician and his response and how much weight was put on his opinion of this nominee, RFK Jr. And I watched in some pride that he did seem to be prioritizing some of the medical priorities that some of us who are highly trained medical professionals would find important. But I also think that I watched gamesmanship and exaggeration of him and his colleagues in how they approached the situation and approached a nominee who I don't know if anyone has remembered is a person. And I think that gets lost sometimes in these games. I was happy to see that he was able to challenge some of the issues that are worrying some of us, but I'm not sure if we got answers that would satisfy any of us. There's concern that there's conflicts of interest. There's concerns that there would be such an approach to leading healthcare in our country that it would harm our children, harm our future. But I was also happy to see that there is mutual interests that are elevated and brought into the discourse, which we've been longing for so long, like the safety of our food supply and all the special interests interfering with that in our country? And would this nominee be able to actually elevate that discussion and bring authority into that and bring change? But as I listen to my healthcare colleagues and I listen to some of you, I'm watching the tensions rise again. And our social media is overrun with really derogatory and defamatory and accusatory posts about worrying about this future we have with a new transition. All the old fights and accusations seem to be reinvigorated, don't they? Oh, here we go again. So, I mean, is this a righteous fight against medical disinformation? Is that is that what we're doing? Is this a righteous fight against harm from medical scientific advance? Is that what some of us are fighting for? Huh? Or is it actually about preventing and treating autism? Is it actually about that? Is it actually about protecting and serving our people? Or have these us and them sides developed and they've stood on their mountain and now they just can't get off the mountain no matter what logic or what cost? And this is, I would point out, the us and them really divisive mindset that has plagued human existence for millennia. And it isn't any different. And I want to point that out. This is what I discern going on, is that there's a lot of suspicion, there's a lot of accusation, and there's a lot of hopelessness that is permeating these discussions amongst my healthcare colleagues. And sadly, some of the most ardent supporters and partners with these mindsets are Christian believers. And these are mindsets that don't come from heaven. And they're harmful to us and they're harmful to our society. And what are we doing? What could we be doing? Because we do have this amazing opportunity to be light and seasoning and to bring something different that could disarm these mindsets that are really troubling us as a nation. What gets us to this point where we actually begin to feel hopelessness about our future? I think we need to actually confront it first in our own hearts. Something is taking away hope. What is that? And how can we actually look at these kind of transitional seasons in our society, in our sphere, in a way that is actually going to lead us into hope? When I actually first started pondering initiating this podcast, I had a moment with God that actually really affected me, and it continues to affect what I choose to talk about and what I choose to highlight. And I had this picture of being in front of a big sculpture of a person. And I had like a sculpting tool in my hand. And I was looking at this sculpture carefully, and it was like the bust, the face of a person, but it was highly deformed and exaggerated. And I saw this as a version of caricature art. And I was there trying to discern, I think, how to correct, how to bring back the beauty in this piece of art. And I felt Jesus right behind me, speaking to me and talking to me. And I felt this sense of one of the purposes that I have for you is to actually carve away what is caricature and find what is true beauty and true identity. And I think sometimes we talk a lot about what's wrong in healthcare, and we're looking to point fingers and bring blame and to get rid of things or to bring in things new. And I think we only have to look at the example of Jesus and what he has done for us individually and how he has called out our real identity and helped that to come to the surface so that we can be our very best selves. His mercy has actually created freedom for us to be able to find our best. And I see us in healthcare right now with this great opportunity, particularly those of us who do believe in this transformative power of Jesus. We have this opportunity to realize that restoring healthcare to something better isn't just about fighting issues. It is more, and I would say more importantly, about restoring people to their true identity, helping them to find their best version of themselves, which is going to bring the transformation to our sphere that we need. Our sphere is going to be transformed not because we change the issues, but because we are able to actually transform each other and transform together, find our very best. We do need to learn to see people as they're truly meant to be, their best selves. Um, it is hard. Our problem is that we see people through the caricatures that our culture or our circles have created, and I'm sure you can think of even just smaller versions of this. There's that resident who did that one bad thing that made that terrible error, and they're viewed through that error the rest of their training time, and they tend to like cycle, circle, and swirl in that new identity that was created for them. Like their one terrible day became that huge nose on their caricature that everyone sees. And it doesn't represent who they really are. I think about political culture and how it distorts people. We need to be careful. Actually, these are people that are serving us, and we deny them their humanity when we partner with the caricatures that our culture is painting of them. I think, it might be hard if you feel really aligned with one political side or the other. And if you tend to feel more aligned with the political left, you have a lot of angst right now as the presidential administration does now bring in a new lean toward the right. And maybe you have a lot of anxiety, but perhaps you are also partnering with the caricatures made about the political right. And is it possible that there is good within it that even God could use? Obviously, I think so. I want to remind those of you who feel that way right now and who are anxious, I understand. And I want to remind you that we actually experienced this in a very significant way during the COVID pandemic. Do you remember what it was like to feel unfairly caricatured by the media, by your community, as a physician or a nurse, trying your very best to care for and save the lives of people in the midst of a lot of uncertainty and unknowns? And do you remember how it felt to be spoken to and sometimes railed at by patients who were upset about little things that we asked them to do to try to help? And what it felt like to be aligned and caricatured in that way. It was a travesty in my heart and mind that heroes of ours, like Dr. Fauci, were caricatured and villainized. And for those of us who are trained healthcare professionals, especially the doctors, Fauci was a hero to us. He wrote our big book of Harrison's Internal Medicine. He had such an impact on what we could learn and what we could do to help people. In fact, the influence of his life and the impact of all that he has done to both learn and teach science and medicine is probably going to be very hard to measure. And yet, here's a man who agreed to step up and take on the weight of this in our country. And so many villainized him and treated him so unfairly. And a lot of that passed on to us. And so like me, I'm sure many of you experienced some of the angst from our communities and not wanting to wear masks in our offices and honestly throwing fits and being incredibly rude and derogatory in our offices and in the hospitals when we were really just trying to work together and collaborate with our healthcare administration, with our local governments, and we were trying to save people's life. I remember having a patient in my office who was so upset that he had to wear a mask in order to accompany his wife into her procedure. And I knew them. They go to my church. And they knew me. And yet he was so upset and he was so angry and he just railed at me for crimes that I had never committed and called me a Fauci lover. And it was just like, wow, it was so psychologically damaging. And it wasn't true. And perhaps there were days that we didn't do the best or the right thing, but we sure tried. And I know that many of you feel that angst now, and some of it is from that psychological trauma of what we lived through, having really given all that we could and risked ourselves and the health of our families in order to take care of our nation. And in the US, feeling so unseen and unappreciated, and instead have something stamped on us that wasn't ours. Hey, healthcare heroes, have you been impacted by this podcast? I've been working on making this content freely available to all of you through my nonprofit, and I would love for you to be able to help me in this effort. You can make a tax-deductible donation at our website, restorehealthcareproject.org. Thank you for helping me champion hope. So let's be careful that we don't do it ourselves. Let's be careful that we don't join in with caricature building. I do see that it is very much the kind of thing that our enemy, the devil, does. He takes our worst day and forever accuses us before God and says, this is who this person is. But remember, Jesus has come to forever advocate for us before God, and we get to join in with that. We don't want to partner with the accuser. We would want to partner with the advocate, and all of us would want to have that given to us. You are not your worst day. No one needs to be their worst day. This is hard for us. We are hurt or we are offended by something someone has done inadvertently or intentionally. And it is hard for us as humans to not separate in such a binary way and label others around us as good or bad. But this is the message of hope that Jesus has brought to us, that you are not your worst day, and that who you were designed and created to be is not determined by your worst day. It's determined by God. And at any moment, no matter how many worst days or years you've been having, you could step into that. You could begin to step into that. And that hope could change everything. God actually calls us good. When He created us, He called us good. When He redeemed us, He called us worth it. He called us adopted. He called us belonging. And He sees the best design He has for us. I experienced this in kind of a practical way, and this is a shout out to my local CEO of my hospital here in Reading. I have had the opportunity to see how caricatures can be harmful and how you can see through them, how you can shave them away. I had been taught by urban legend of many physicians and nurses in my hospital that the hospital administration was really treacherous and untrustworthy and very difficult to deal with. And they would sooner betray you and use you. And when I had the opportunity to actually work with my hospital administration, I felt caution in my heart, but I also felt this, I want to know who these people really are. And I want to see them for who they really are and see the best in them. I want to see beyond these caricatures. I want to see if they're not real. And I discovered that to be true. I have absolutely enjoyed working with my hospital CEO and finding out his heart for our community and all the ways that he is trying to balance so many conflicting interests. And finding that these caricatures are not real, and I can shave them down, and I can find the best in him, and I can celebrate it. Everyone wants somebody to stand with them and support them, and not forever accuse them of being what maybe they were once on their one bad day. I think that is possible even in this current climate. And you may actually be very optimistic about this current climate in our country and what could change. This could be completely a different perspective that you hold right now. But I still want to caution you that we need to set aside this tendency that we have towards suspicion. I have found that mindsets of suspicion, they really war against hope. They can't coexist with hope. Have you ever noticed that? Suspicion is actually not wisdom, and it's a counterfeit. It kind of looks like wisdom, like you're discerning something about someone, but it isn't. And the way that you can tell that it's not wisdom is that it doesn't lead you to hope. And it doesn't lead you to see and embrace the best in someone. I have always noticed that suspicion hangs out with accusation. And as soon as I start to hear accusation in something, I know it's not from heaven. I know it's not the kind of thing that I actually want to let into my heart. Even if there's truth there, if it partners with accusation, it no longer is what God would be saying. On the other hand, wisdom hangs out with hope. And if you want to find real wisdom, you are going to have to become good friends with hope. And it's actually possible. It's actually possible to discipline your thoughts and to discipline your speech so that you're choosing hope instead of suspicion. And it's really sorely lacking in our culture. Our media knows that they can actually get us to click on things that it stirs up this suspicion and hopelessness. We are drawn to that. But what if we actually, in our practice, intentionally choose to step away from that and choose hope? Is it naive and immature to think that hope can lead the way? I don't think so. I would challenge that. And the reason I would challenge that is I see the way that I see the world is that hope is what changes everything. Hope is the fuel for every human engine that you can think of. Hope is what powers you through long contract negotiations that eventually lead to some sort of negotiated agreement and the institution of potentially positive change. Hope is what keeps you going through that, not suspicion. Hope is what powers you through writing and rewriting policies in your workplace to try to increase and improve what you're able to give and the conditions in which those around you are giving. Hope is what leads you to try again, to patiently teach a young surgeon, a young nurse, the correct technique rather than gossiping about them and writing them off and leaving them to harm themselves and others because they're just so incompetent. Hope is what teachers carry as they teach them again, as they show them again, as they believe in them again. If you just keep practicing, you will get better. Everything that is worth doing to restore health and healing in our world actually gets done only when hope is in the gas tank. We're not going to be able to fuel what we need if we're filling up our gas tank with these caricatures of doom and gloom and accusation and suspicion. What if we began to actually intentionally grab hope? Wisdom is given to those who search for it. Proverbs tells us that. And the way we search for wisdom, I believe, is through intentional hope. The tool in your hand as you walk with Jesus and you work on deconstructing first the caricatures for your own mind is hope. Is there any chance that we'll be able to deconstruct these caricatures on a societal level? Well, I don't know, but we certainly won't be able to if we can't deconstruct them in our own minds. And maybe we will get the opportunity to have an impact on deconstructing them for others too. Is RFK Jr. going to be a godsend for righteousness and healthcare? Or is he going to be an evildoer and a treacherous one, creating chaos? I don't know. I don't know, actually. But I do know that I want to discern well And I need hope to be my guide to do that. Hope does not deny the presence of evil. It doesn't deny that there are things wrong, but it discounts the power of evil to destroy all things indefinitely. So hope would say, yeah, there is the potential. There is risk. There is maybe danger even, but I don't believe that it is going to be forever or indefinite or that it actually will result in forever harm. What if, in fact, even some things that aren't quite what I would agree with or what I would choose or what I would want or actually are harmful could actually lead to change somehow? I believe that that's still possible. Transformation can come in the moments of deepest darkness. I still know and believe that. Even if whoever is confirmed as the Health and Human Services Secretary in the country doesn't live out of his best self, even if, what if what he does ends up being a catalyst to help the next one do better? I mean, we literally, with hope, cannot face anything that is insurmountable. What if we get more research that helps to promote vaccine safety? What if that gets elevated? Isn't that something that we all want? What if it provides more opportunity for us to teach our communities and our society about the reasons and the science behind the vaccine schedules and why we as healthcare professionals know them to be good and not harmful? What if we actually get more opportunity to help people learn? What if that ends up protecting more children? What if our societies can actually relearn some of the medical misinformation that they've grabbed? What if it's actually possible? Why do I need to jump on the slide of hopelessness? I don't need to do that. What if we can find a way to help allay fears in both our healthcare and our cultural communities about medical advances? And in the future, we could set templates up for ways that communities can better receive and feel safe in medical advances. What if actually we could develop committees of both pro-vaccine and anti-vaccine members that actually work together, dialogue, and actually negotiate ways to move our country forward into more good? What if vaccine prices and access could become more equitable, not just for us, but around the world? I know many of you are worrying that there's just so many things that could go wrong with this, and we could lose so much medical advance. But I want you to think about, could you see past the caricatures and could you have hope? Because that kind of hope could drive change that none of us have actually worried about yet. If you have no alternative vision for the future that you are hoping for and praying for, why would you expect to get anything different? You don't need to just react to what culture's headlines are throwing at you. You can actually begin to develop a dream and a vision for a different, more hopeful outcome. Our hope can be collective. It can become collective hope that drives many into positive action for the sake of our countries. Do we actually believe that nothing can separate us from the love of God? The kind of love of God that Paul says is in Christ Jesus. That kind of love was the kind of love that tore the curtain in the temple, that separated people from God. The kind of love that removes the dividing barriers between you and me. That's the kind of love that Jesus demonstrated. Ephesians 2:14 says, "For he himself is our peace, who made both groups into one and broke down the barrier of the dividing wall by abolishing in his flesh the hostility." Any hostility you feel in our nations currently? "Which is the law composed of commandments expressed in ordinances, so that in himself he might make the two one new person, in this way establishing peace." And at that time, Paul was speaking to two groups that were hostile to each other, being Jews and Gentiles. might it have also some ramifications for our day? Here's a little challenge for you. Check out your social media. What does it say about you and whether or not you're friends with suspicion and accusation or friends with hope? Is there a little too much critical accusation, maybe? Is that who you want to be? Is that what you want to partner with? Maybe check out your conversation. Maybe you have sworn off social media for a while, which might not be a bad idea. But what is present in your most frequent conversations? Are you hopeful? Are you choosing to let the words that come out of your mouth be hopeful and building up? Can you use your hope to carve down the caricatures our culture is trying to serve us? Can you see people and allow them to have their humanity and their dignity and believe that people can fulfill their design in the right atmosphere of hope? I see us with the tools of hope together addressing these caricatures and believing for the best in people. Because after all, He has believed for the best in us. I'm Dr. Jennifer Kang, and this is the Restore Healthcare Project. Healthcare professionals, I'm so excited to be able to connect with you on issues regarding spiritual needs in healthcare. We want to partner together to see some of the ruined places of healthcare culture restored by hope. Follow us at restorehealthcareproject.org and like and subscribe to our YouTube channel and social media.